Hey guys, so today we're going to talk to you about our company, Reveille Medical Solutions. So we want to help everyone to achieve accessibility to quality and cost-effective healthcare. So these are our members. I'm Marina Costilla. I'm a sociology major here at Texas A&M University. I'm in College of Liberal Arts. This is Gabriel Biddle. This is Carlos Ramos. This is Elise Coleman and Trinity Boudreau. So I want to share a story with you guys. When I was a junior in high school, I played a soccer game and I got hit in the head really, really hard. I had really severe bleeding, and thankfully, where I live, there was a hospital 3 minutes away. But soon after that, our hospital got closed because of bankruptcy. So I live right here. All of these are now clinics. This was taken yesterday, right? And all you can see are all these little clinics. And the closest hospital to me is an hour away. So imagine that hospital was closed, right, when I got injured. I would have had to travel an hour away while bleeding a lot. So with telehealth and telemedicine, my family could have had some kind of help to assist them to keep me stable until I could have reached the hospital. There's also 911, don't forget 911 if you're ever hurt. But for the sake of this speech, telehealth or telemedicine could have been your answer. So what is telemedicine and telehealth? Well, according to the American Journal of Medicine in 2014, telemedicine is using technology to enable clinical services to leverage information technologies, video imaging, and telecommunication linkages to enable doctors to provide healthcare services at a distance. To summarize, it is using technology to send information to your doctor, to your provider, so you can get the healthcare that you need. Right? Telehealth is just a general term for telemedicine, telepharmacy, telenursing. There's different kinds. All right, so our company will be able to provide patient-provider relationships and provider-to-provider relationships. So we have synchronous and asynchronous, as this picture says. Asynchronous is just communication that's not in real time. So there will be like some kind of delay, whether it be email or text message. There's also synchronous, which would be phone calls or video conferencing. And this was, the last one was according to the National Cancer Institute. So here's a basic process cycle. It's really simple. So you'll have the patient get on a telecommunication service, whether it be Skype or Zoom or FaceTime, and they will enter their full name, their phone number, and an ID. There will also be a passcode that is specific to them, so there won't be any kind of conflict. They will access this, they will be able to communicate with their physician, nurse practitioner, specialist, what have you. And we are trying to get funding for rural facilities and also get tech equipment to distribute to these people who are in rural areas that really need it. So think of me, think of any small towns that have like a hospital an hour, 2 hours away. So our system is HIPAA compliant. So every doctor has to follow rules to make sure that they don't expose any private information to anyone. The way that we do this is thanks to the U.S. Department of Health and Human Services and pharmacy boards changing legislation just a little bit. So what this means is physicians have to follow specific guidelines, especially when dealing with cybersecurity and insurance, because people can access this information if it's not secure. And that was according to the Journal of Medical Studies in 2020. And so the way we do this is we want to make sure that these patients that are using telecommunication can get a diagnosis with the nurse practitioner, PA, nurses, people that are able to do that, and get prescriptions by the physicians that can actually give these prescriptions. So now we're still in pandemic, COVID, right? growing and getting more attention because of COVID. And as you can see, in the first 2 weeks of the stay-at-home order, the telemedicine services increased by 86% or higher in the US. There was an exception, which was a hospital in Fayetteville in North Carolina, but they still were able to increase in usage from 2% to 24%. So regardless of the magnitude of their increase, they were still able to increase that service. And here you can still see the surveillance. This was done by the Central Disease Control. Yes. Anyway, so you can see the increase from 2019. 2019 would be these light blue ones, and 2020 are the dark blue ones. And that was from the World Health Organization. Okay. So why is telemedicine growing? Well, there are a couple of reasons, but some key reasons that I wanted to point out was convenience. So you were able to reach physicians, doctors, nurses, specialists a lot faster with just a link and an internet connection. And if you don't have internet connection with us, you can still find some clinics close to you. So we also said that patient and provider protection is also a really valuable reason for telemedicine, because with COVID, you're social distancing, but if you have a serious condition that can be really contagious, it's really good for you to communicate at a distance. There's also been a shortage of personal protective equipment, and this was seen with the 2022 model. 89 million medical masks are required each month, 76 million examination gloves each month, and 1.6 million goggles had to be bought each month. This is a lot of money, a lot of equipment that is necessary, and we're not meeting those demands. So with the use of telemedicine, we can reduce these numbers or reduce the costs and be able to talk to patients in need without all of this getting in the way. All right, so more here to talk to you more about accessibility to healthcare is Trinity Control. So,
first off, the needs we are seeking to tackle are healthcare accessibility and how effectively it can be done. So in our research, we were able to see that there's the breakdown comes between issues where you need partly telemedicine and in-person medicine. So any kind of element where you would need scans or blood work, something you'd have to go in person to do. We found that 1 in 4 people do not have a primary healthcare provider. They don't have one specifically under their insurance that's their healthcare provider. This was found by the U.S. Institute of Medicine in 2010. This graph breaks down just a random 1,000 group of people in the U.S. 800 will report their symptoms to someone in the medical field who can help them. 300 will consider seeking medical care. Only 200 will even try to go to a physician's office because they are aware that there aren't that many primary care physicians. The specifics of that is also by the U.S. Institute. There's 90% healthcare specialists, so if you needed like an ortho consult, a dental consult, something specific, but no one to write you the sign-off for that consult. There's only 10% of those people. This also creates excessive travel to get to these specialists. So this is a map of Austin Regional Clinic locations in the greater Austin area. While there's lots of locations in the area, there may only be one ENT specialist here, one allergen specialist here. They're very spread out, and all of these people require these consults, but they have to travel through Austin, which takes over an hour in motion. So this also creates an overall waiting time that is So Ansel Dominique did a study in 2017 that showed how certain diseases escalate when you wait too long to get them treated. So he found not only did these people have to wait anywhere between 14.8 days for just seeing a doctor, between 14.8 days and 36.8 days to see a doctor, but if they had heart disease, then that ailment would maybe become intreatable if they waited too long. His direct quote is, "Adverse consequences arise from prolonged waiting for primary care." So the wait is where much of this cost comes in, or much of the personal cost comes in, and it creates more issues down the road. And so another issue when we get into, if you made it past the point of getting that consult, say the ENT doctor that you talked to said, "I can't help you, we're gonna have to send you to another person." Maybe that person isn't in this group system, so they'll have to send your information to a completely different database. This is an issue because different databases, different companies have various ways of moving their documents. So this is just one company, Lee Medical Care Review. They have over 10 steps for just one patient, just one visit to one of their clinics or hospitals. This can get messy because switching between databases may violate HIPAA. And then Steve Langer found that cybercrime and malware on medical data evolves right alongside the programs and firewalls that are meant to stop it. He found this in 2017, and with the increase of telehealth, this can only get worse because they need more and more ways to encrypt data and keep it private and protect patients. And so this creates an issue because there are many diseases, this one is for diabetes, that can be treated rather simply. They found ways to treat it consistently, but because of cost, many of the people with that disease cannot get the treatment they need. And so from the Centers for Medicaid and Medicare Service, medical testing and medical consults have cost, in 1980, they cost around $250 billion a year to get everyone who comes into the medical system consulted and tested correctly. But now in 2017, it was $2.2 trillion. And much of this goes to the patients and just some of it gets unpaid, and then no one receives the treatment they need. And so these are all the things that we are trying to mitigate with Reveille Medical Service. And now that we have covered the concerns and shown what telehealth still needs, Elise is here to talk about our solutions to these problems.
Okay, I'm going to talk to you guys about the increasing quality of healthcare. Proactive MD says what's probably the most obvious. The most important factor to improving healthcare is to have access to healthcare. OrthoLine also suggests that patients in rural areas don't have great access to healthcare because of travel times. It also costs a lot of money for them, not only because of travel times and gas, but also because they're cutting out on work time. They're taking time off of work, they might have children, so having children, they might have to get help, like babysitters for their children, and that just takes more money out of their pocket just because they have a cough or they have the flu. With telemedicine, for these, when you're feeling ill, you can just get on the phone, talk to a doctor, and then they can prescribe you medicines, and you can go to the nearest clinic and then just pick up those medicines where you don't have to actually travel very far to go get those. Kentucky RHIO says that telemedicine can save money in the long run, and that's also due to travel times. That can save it for the patients, but also it can save it for the providers as well. So in this little diagram here, it also talks about like the different types of minutes and like what your time is worth in your overall savings. But it can go more into depth with that. So for the providers, since they're not having to do travel time as well, they can see more patients. So that will increase their revenue, which can get them more money in their pocket. Also, not only does mitigating the travel times increase money, but it also increases in continuing education. If they have more time on their hands, they can always continue their education with different types. They can even do telehealth to continue their education by going to different types of conferences that might not be in their state, and you can do that all through telehealth. Now we're going to talk about the feasibility of telehealth. Brian Williams Hansfield probably says like the most obvious one, which is the comfort of your home, which whenever you're ill, you don't really want to get dressed, get in your car, and then drive to somewhere where there's a bunch of people in a waiting room and then sit there for 30 minutes until you get to see your doctor. So you can do that all from the comfort of your home. But this also, Hansfield also states that it controls the spread of disease. So we all know that COVID-19 was a highly contractable disease, which was probably needed for telehealth. But also it can go beyond COVID-19. It can go to people with chronic illnesses who are homebounded, or elderly people who are also homebounded, or immune compromised people who just simply can't leave their home because they are too sick and too ill. But OrthoLive also states that for no-shows, that will also be mitigated. No-shows are mostly seen in follow-up appointments. So whenever you go and you're super ill, and then you get a follow-up appointment, but you have school, you have work, or you just feel better, you're not going to go, but that also loses the company money. So having telehealth will mitigate those no-shows. But Kentucky RHIO also talks about patient compliance. And this was a little research study that they did. These are the ones for telehealth, and these are the ones for inpatients. So the patient compliance basically means that like they're managing people with chronic illnesses better. So they're going to see their doctors more, they're talking to their doctors more, they're getting better feedback, better help, and it helps them move along in their process and create an overall better health for these individuals with chronic diseases. Now we're going to talk about the data behind medicine. The University of Pittsburgh talks about how we can use big data and put that into predictive modeling, maybe even machine learning. And with all this data that we are getting, we're sending it to basically like one data house, basically. And we can take all that information and put it into a cloud storage, which is highly secure, which also is very good for patient information. And then we can predict what their illness could be off of like different types of symptoms that people have. Lisa Ellis talks about the health outcomes research, which is kind of like this model right here. So it talks about clinical outcomes, patient-oriented outcomes, and then consumer-related outcomes and economic outcomes. With that, Lisa Ellis in a later article talks about how this model is specific to the patient. So not everyone with the flu is going to have the same symptoms. Not everyone with the flu might have allergies. So having a system that is specific to the individual, you can get different types of medicines that go with your body, different types of things that work with you, with yourself. Now that I have addressed the solution, Carlos Ramos will discuss the business model of Reveille.
Hello. Here at Reveille Medical Solutions, we aspire to conduct our business through 5 core values, being transparency, quality, security, and accessibility. We want to be transparent, which means that we want the price that you see be the price that you pay A big issue with healthcare is that usually you don't really know what anything's going to cost. There's so many factors and variables that somebody might give you a cost, but at the end of the day, what's going to be on the bill is going to be completely different, and you might not know where your money is going. We want to ensure quality of service. We want to make sure that our patients, our consumers receive the best quality of healthcare that they can. We want to provide security for our patients. We want to make sure that our patients feel secure, to be willing to be conducting these consults online and be giving out personal information. We want to be accessible. We want to be able to reach anyone and everyone. We want everybody to have an equitable opportunity to visit a doctor and receive the care that they deserve. Our business is conducted through three main branches. First, we have the hybrid telehealth branch, our informatics and diagnostics branch. The overall goal of this company is to provide quality and equitable healthcare to all populations. Our business model. First and foremost, we have the hybrid telehealth network. This right here is meant to give quality consultations through our own platform and provide additional services that the patient might need in order to reach diagnosis. In our telehealth model, we were going to give consultations through a direct-to-consumer approach. According to Dalgarin in 2021, the direct-to-consumer approach allows patients to reach providers at convenience at whatever time they need, whenever they can, whenever they have time, at their convenience. We are meant to be available for them to reach out to us whenever it is that they need care. The consultations are meant to be done online through patients will be consulted through our nurses, PAs, and clinical nurse specialists. According to Pavas et al., registered nurses, we will use them because they're extremely valuable to this operation. Nurses give a valuable contribution through their extensive knowledge in primary and preventive care. They're able to also prescribe drugs to patients. So this means that you no longer need to go to a primary general practitioner or any primary care doctor. You can go directly to a PA, a nurses. You can connect to them online. You can talk to them. They can carry out a consult. And from there, if your symptoms are minor, they can make a decision. This is very important because a great majority of cases, they won't need any secondary medication. They won't need any extensive procedures. If you're able to take the problem out from the root, then you'll be able to reach the great majority of good health outcomes. Additionally, we strive to provide any other services that the patient might need that might not be available through just telehealth. So what this means is that if a patient has other symptoms that we ourselves cannot diagnose through a telehealth consult, then we will ask them to come to an in-person clinic in order for somebody to be able to see them in person if that's how they wish. We also strive to provide imaging and lab services in order for patients that have abnormal symptoms, things that we can't see or hear with just regular tools that we have at our disposal. All this data is meant to be compiled into a file and uploaded to our cloud. This is the most important part of our company because it's the face of our company and it's where we will be interacting with our patients the most. Secondary is our informatics network. This branch is very important because it's supposed to connect both the frontline and the diagnostic center. So what they're going to do is that they're going to compile all the data specific to one single patient and make it into a nice, neat file. It's going to be undergoing constant monitoring to ensure that none of the information is breached, ensure the security of our own patients, and they'll be able to allow that any physicians that we're going to be employing to be able to access the data and give a constant stream of information to make sure our physicians always know what's going on with the patients. According to Giorgio et al., diagnostic error is equivalent to 10% of all patient deaths. The monitoring service is meant to make sure that all the information is there in time, that doctors are able to have the best information available so they make the best decisions in order to prevent any unnecessary deaths. Also, the informatics center is meant to always keep tabs on all of our facilities to make sure that they are running efficiently and generate reports in order to attenuate to every single clinic and their needs. Finally, our diagnostic center is where we will employ specialists to view and interpret the files of each of our patients. Since our doctors won't be consulting or giving face-to-face, they will have more time and give more attention to every specific case. They'll be able to take more time, have more time to think, and be able to reach the best conclusion that they can. Our doctors will be salaried employees, and they will be paid on a bonus schedule. We want to follow a pay-for-performance model because we believe that is better for a pay-for-volume. Pay-for-volume means that usually doctors, the way that they get paid is that they get paid a set amount for every patient that they see. So they are incentivized to go through as many patients as they can in one day. Since most of the patients will be screening them through our nurses and everybody else, they won't have to do primary and preventative care services. They'll be able to go right through their specialty and see what is wrong with information knowledge that is specific to them. Sura in 2010 suggests that pay for performance scheme incentivizes doctors to perform their best and try their hardest to achieve the best health outcome for the patient. Having said this, we will now go over to Gabriel, and he will explain the solutions that our model gives in order to give the best health care to our patients.
Howdy. So firstly, I'm going to talk to you how telemedicine reduces the cost for both the provider of the telemedicine and the consumer. That can be seen from this graph. Normal consultations run you about $100 per visit, while a telemedicine visit will cost you around $53. This is found by a study by Snoswell, and with cheaper telemedicine, it'll allow more people to have access to healthcare. Poor people that usually would just have to deal with their symptoms can now see more doctors and can also get healthier throughout their life. This reduced cost increases volume and allows for more consultations throughout the day. Our PAs and nurses will screen majority of our clients coming in, and this will allow the doctors to see the more severe cases and actually provide them the care that they need. Also, it can be stated that these consultations can be cheaper than they already are through optimization of programs. Now I'm going to talk to you how this can actually increase access. So we will not only increase the amount of people that are seen, but it will increase the area covered. So with our telemedicine, we can see as many people as possible, but also having our clinics in rural areas will allow more people with serious conditions to come in and still get the help they need. According to BAT 2018, telehealth can provide healthcare to unsecured populations, but also according to McKinsey & Co. in 2020, doctors' visits have gone up 50 to 175 times since the beginning of the pandemic, and this is leading to doctors feeling overwhelmed and feeling that they need to see as many people as possible, but they need to feel comfortable so they can provide the best care possible. This will also provide the nurses to reduce contact with patients. As you can see with this picture, this nurse has to have a lot of equipment on just to deal with the COVID patient. If we can just conduct this consultation through a video, she will have to be as uncomfortable as she is, and we will still get the same amount of service done. Okay. ICN stated that over the pandemic starting in 2020, millions of nurses have been infected with COVID-19. This is worse in rural areas as these nurses can't get the big help that they need. And also according to MITE in 2014, the rural rates of morbidity and mortality are increased in rural populations. As can be seen from all of these studies, the rural areas are where we need to study most. Now I'm going to talk to you about the future of our market. Telehealth market is projected to grow by 300% in 2018, or by 2028, sorry. Telemedicine can increase the opportunities for post-operation activities. This includes physical therapy, post-operation blood work, and post-operation checkups. Real quick, I'm gonna tell you a story. I had surgery done in August to get my appendix out, and through telemedicine, they were able to check up on my scars and see how I was healing throughout the whole process. That was through Methodist in downtown Houston, but imagine if everyone could get this service wherever they are. So we would offer you $50 million for 10% of our company. We get this valuation from bigger companies in our sphere. Teladoc, which is the biggest company right now, has a valuation of $14.9 billion. And as the market continues to grow, we would want to get in on this early. At a valuation of $500 million, we feel like this is a genuine number. This $50 million will allow us to open up more clinics, have more operators, and more call centers. Today, we've talked to you about what telehealth is, the problems telehealth solves, our business model, and what the future holds for our company. Thank you.